Continuous murmurs can be heard both during systole and diastole, and they come in different types. Hello, I'm Dr. Habibi, and in this video, I want to explain heart murmurs in simple and understandable language, so stay with me. One of the main causes of continuous murmurs is PDA, or patent ductus arteriosus, which is an arterial connection between the aorta and the pulmonary artery. The pressure in the aorta is 120 over 80 millimeters of mercury, and the pressure in the pulmonary artery is 20 over 10 millimeters of mercury. Therefore, there is a gradient between the aorta and the pulmonary artery both in systole and diastole. When blood flows from the aorta into the pulmonary artery, the blood flow becomes turbulent, and it's this turbulence that leads to the murmur. The next condition that can cause a continuous murmur is rupture of the sinus of Valsalva. We call this part the aortic root. Rupture of the sinus of Valsalva causes this part of the aortic root to connect with the right ventricle. And since the pressure in the aorta is 120 over 80 millimeters of mercury, and the pressure in the right ventricle is 20 over 10 millimeters of mercury, this results in a gradient both during systole and diastole. And this same pressure gradient causes the blood flow to become turbulent when it moves from the aorta into the right ventricle, which produces a murmur. Therefore, the murmur that occurs will be continuous, because there is a gradient both during systole and diastole. The next condition that leads to a continuous murmur is AV fistula, or arteriovenous fistula. This happens when there is a connection between an artery and a vein, and in many cases, we create it iatrogenically. For example, in patients who are going to undergo dialysis. In dialysis patients, we surgically connect an artery to a vein, and as you know, arterial blood pressure is 120 over 80 millimeters of mercury, while venous pressure is less than 5 millimeters of mercury. This causes blood to flow from the artery into the vein during both systole and diastole, and because the pressure gradient is so high, the blood flow changes from laminar to turbulent. We can detect this turbulence as a brute by placing a stethoscope over the artery, or even as a thrill and vibration by placing our hand on the artery. The next condition that leads to a continuous brute is branch artery stenosis. Stenosis causes the pressure before the narrowing and the pressure after the narrowing to be different from each other. For example, if the pressure before the stenosis is 120 over 80 millimeters of mercury, the pressure after the stenosis might be 60 over 20 millimeters of mercury, and this causes a pressure gradient to exist in both systole and diastole. Therefore, in both systole and diastole, the blood flow becomes turbulent, and we can hear it as a continuous murmur. So, with continuous murmurs, the murmur is heard during both systole and diastole. If you found this part of the video helpful so far, please like it and share it with your friends. And if you don't want to miss my upcoming videos, please subscribe. Some types of continuous murmurs, or continuous and persistent murmurs, are benign, which we call benign variants. Two murmurs fall into this category. The first one is cervical venous hum. As the name suggests, it's caused by turbulent blood flow in the neck vessels, especially the jugular veins. Cervical venous hum is more common and more easily heard in children, and it increases when the child is sitting, but disappears when they are lying down or in a supine position. This murmur is continuous, meaning it can be heard during both systole and diastole, but it is louder during diastole. If you apply pressure to the neck, this murmur disappears. The second murmur is the Mammary Souffle or pregnancy murmur, which occurs in breastfeeding and pregnant women due to increased blood flow in the chest. These are also heard as continuous murmurs. Both the cervical venous hum and the Mammary Souffle of pregnancy are benign murmurs that, despite being continuous, do not cause any problems or disease for the individual.